More and more frequently, health topics are being reported in the news. These can serve as talking points, as political debate items, and they can also force people to think about their health differently. The news media may also introduce people to health information that they didn't even know existed, and it may force them to reevaluate the type of considerations they're making about their health. Given the constant flow of news stories and the wide variety of sources that are carrying these news stories, it can be difficult to determine which ones are most newsworthy and important to people.
Welcome to Module 6 in the Finding and Using Research Evidence, a Guide for Citizens course. In this module, we'll focus on the Hitting the Headlines Twitter service. Many of us get the latest health information from the media, but we all know that this can be quite challenging. Specifically, many citizens cite frustrations by the fact that the media often sensationalizes research, presents mixed and inconsistent results, and all of this can be very confusing. The media tends to focus on the wrong things that grab the most attention while sensationalizing issues regardless of what the evidence says. The media focus on the results of single studies rather than systematic reviews, and this can be limiting as it may not tell the entire story. Furthermore, when media present research evidence, they rarely consider its quality. One potential solution would be easy and timely access to relevant, high-quality research evidence linked directly to the topics covered in the headlines. This would help make things simpler and reduce the confusion faced by citizens and patients as they read the headlines each day. While some journalists and news media may be dedicated to making sure they've drawn conclusions based on the best evidence, for example, the Science-ish column that used to be provided in Maclean's magazine, this is rarely the case, and citizens are left with the responsibility to be educated consumers on their own. However, not all citizens and patients will necessarily have the time or even the motivation to constantly cross-check and fact-check what the evidence says in relation to the most talked about news stories. This is despite the fact that there are readily available one-stop shops that facilitate easy access to research evidence. One illustration of an approach to link the best available research evidence to the news stories about health making the headlines is the McMaster Optimal Aging Portal's Hitting the Headlines Twitter service. This service provides a quick and simple way for citizens and patients to stay up to date with the latest news headlines related to optimal aging, and then to understand whether and how they align with the best available research evidence. Each morning, a member of the portal team identifies the latest news headlines that relate to optimal aging. The team then finds whether there's evidence to support or refute what's in the headlines, and then presents it in an easy-to-access format on the front page of the portal. If you subscribe to Twitter, you can go directly to the Twitter feed. To help you quickly make the connection between the news headlines and the best available research evidence, the Twitter feed provides a first tweet that says news, which highlights the headline, and this is immediately followed up by a tweet that says evidence, which weighs in on what the evidence says about that headline.
Finding and understanding whether claims made in the media are backed up by the best available research evidence is something that not everyone is equipped to do. Having a service that does this for people and disseminates it in a way that is easy to access and understand, such as through Twitter, is a possible solution to this challenge. More and more people are looking to the news to provide them with information about health. A service that weighs in on whether the claims made in the media are backed up by research evidence or not backed up by research evidence is a very important step to ensure that consumers are engaged, but also informed about what the media is saying to them.